So I'd like to talk a little bit about neuroma. Neuroma is a mass that grows from any nervous tissue, usually a benign tumor, and can arise after trauma. Normally, after trauma, the proximal portion of the nerve tries to regenerate, sends axon distally, where in amputation it meets scar tissue, it folds back, and the fibers proliferate randomly, and causing a tumor. The symptoms can occur months or years after the trauma, and the pain can be spontaneous, as in phantom pain in the missing leg or in the stamp, or can be evoked by pressure of the prosthesis. The treatment so far is reapproximation of the nerve endings, re-embed the stamp away from the scar tissue in the fat, or pain management with medication or invasive procedures. Our study is an independent study using MRI guided focus ultrasound treating painful neuromas in amputees. We started last year, and so far we recruited 5 patients. In total 6 treatments. We at first did not succeed with the ablations because we have a learning curve how to ablate. We had 2 successful patients half a year ago, one on April and the other one on May. On April we had a full successful ablation, but on May only partially. Both of the patients underwent below knee amputation due to trauma, and we used different methods, approaches to ablate the neuroma. On April you can see that the spot, the neuroma is delineated by orange line, and below the focus, below the spot we had soft tissue. Above the neuroma, there is the bone, and on May, we tried to avoid the bone because on April we had, after 2 weeks, the patient experienced pain, maybe because of bone necrosis, we're not sure. So on May, we tried to avoid the bone, and you can see there is in the focal point soft tissue, the neuroma, and then again soft tissue. Of course, the distance between the skin lesion in order to avoid the bone increased, so the energy used increased, and as a result, on April we had an excellent heating. We believe it's because of the bone. If you look at the thermometry, we reached 74 degrees, which is our goal, above 65 degrees for ablation. And after the end of the sonication, we see the heat remains. We got a full ablation after 24 sonication, but on May, where we did not have bone, we see that the temperature raised only to 44 degrees, which is not ablation. And there is a drop of the temperature after the end of the sonication. After 22 sonications, we did not reach full ablation. To conclude, we only have 2 patients so far with success, so we cannot draw any conclusions, but some observations. If we have bone superior to the range of treatment, that allows us to get ablation temperature. The T2 intensity of the neuroma could provide some insight how well the tissue will react, because the more fibrotic the neuroma is, the easier it is to heat it up. The trajectory that the ultrasound passed through is also important, because if we have scar tissue, healthy muscle, there is a difference in the amount of energy we need. Also, from the point of view of the correlation between clinical results and radiological results, in the April patient, where we got a full ablation, the pain decreased from 9 to 6, but when we did not reach full ablation, the pain score decreased from 10 to 0, so the patient is still pain-free, maybe because of neuromodulation and not from the ablation itself. So It's still to be determined if we want to ablate the neuroma or just neuromodulate it. Thank you.